Hello and welcome to Second Opinion. I'm your host, Dr. Ebony Hilton, and I'm so glad you're joining us. When it comes to your health, one voice is never enough. That's why it's always important to get a second opinion, especially when the questions feel big, personal, or overwhelming. This show is your safe space to pause, take a breath, and gain clarity on issues affecting your body. Each week, we'll bring you trusted medical experts from across the spectrum of care, from mental health and sexual wellness to infectious diseases, from chronic illnesses to the headlines that are shaping how we live and heal. Today, we'll break down complex information, cut through the noise, and talk honestly about what it means for you and your family. Our goal is simple: to help you stay informed, empowered, and proactive about your health without fear or confusion. So get comfortable, stay curious, and join us as we take a deeper look at the issues that matter most to your well-being. This is Second Opinion. According to Johns Hopkins Medicine, an estimated 20 to 50% of women who are in their reproductive ages currently have fibroids. So what are fibroids? They're these uterine growths, non-cancerous, made of smooth muscle cells around the uterus. While some women do not experience any symptoms at all, others have heavy periods, pelvic pressure, or pain. Congresswoman Yvette Clarke of New York is a leading advocate for legislation on uterine fibroids. She is chair of the Congressional Black Caucus. She has championed the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act, which seeks to authorize significant NIH funding for research and expand CDC education. So join me in welcoming Congresswoman.
Well, thank you so much for having me. It's certainly my honor, my privilege to be here and to champion this legislation. You know, back in July, we did a comprehensive legislative package, which not only introduced the Stephanie Tubbs Jones Uterine Fibroid and Fibroid Research and Education Act, but also introduced the Uterine Fibroid Intervention and Gynecological Health Treatment Act and the Uterine Cancer Study Act, all of which, is a part of women's uterine health. And we thought it was important because of the way that particularly Black women have suffered from these conditions without any real research being done or any insight into what is causing what I would consider to be an epidemic in this country of women who suffer in silence with these conditions, and some who have, unfortunately, due to uterine cancer, lost their lives.
Right. You know, it's one of those things of where there's so many people that are in power and to make these policies that don't have a uterus, right? That, for instance, the Trump administration, they've cut several research projects devoted to various minority ethnic groups and women in particular. So how do you feel about the investment in the uterine fibroids? Have you already seen an impact that this administration has had on your foundation?
Well, we've been fortunate in that, we continue as a co-equal branch of government to at least appropriate some funding for this work. There's a commitment to $30 million a year for from fiscal year 2024 through 2028 that is dedicated to this very mission. And the issue becomes, dealing with the Trump administration's secretary, who clearly is not working in the best interest of the American people, whether in fact the NIH will be empowered to utilize this funding as intended. And that's what we have to keep our eyes on in this moment. This is just the floor for what we know needs to be done in terms of research, what we know needs to be done in terms of education, which is another challenge with this administration. But we have the marker. And as we continue to raise awareness about these conditions and how they impact Black women so severely, we ultimately believe that we will be triumphant in getting this legislation passed, signed into law, and faithfully executed on.
You know, that is tremendous. $30 million is a huge pool of funds. What can the individual patient, what can the individual woman expect to see on the ground level? Or is this primarily in the research academic arena?
Well, it is in the research and academic area, but it's also about education. What we know is that, there isn't a lot of education in the gynecological uh, uh, um, area that speaks to the lived experiences of Black women and Black girls. And this oversight, or blind spot, if you will, makes it possible for the public, Black women in particular, to go with, for years, not realizing that they have this condition until it becomes so apparent through various pain, through the growth of these fibroids in the uterus, and for the as you stated in your opening, the heavy flow of these women endure. And so, it's important that we begin very early on with young girls who are going through puberty, to be able to recognize the symptoms of the growth of fibroids. Also encouraging, regular visits to gynecologists who are also educated about this condition, and can look to giving young people the opportunity to seek treatments and to head this off before it becomes a debilitating condition for them.
Right. You know, you bring up such excellent points. Oftentimes when you're going through puberty, you talk to the elders and you say, hey, I'm hurting. Is this normal? And oftentimes you'll hear people say, oh yeah, it's your menstrual cycle. You're supposed to hurt. And so we don't do that deep dive and educate ourselves about what is typical normal and what is something that we should do some investigation. So what can people who are watching do to encourage their representatives to support bills that fund education and research specifically for fibroids?
Well, we have really begun a groundswell of women across this nation, different organizations that are doing just that, that are educating the public and Black women and girls in particular about this condition, getting them involved in really action and activism around it, so that this level of awareness helps to build the type of pressure, if you will, for this legislation to become law. Once it becomes law, we have certainty around the commitment to the research that needs to be done, to the education that needs to be done, so that we can get to the bottom of what is causing this in the women of our civil society. While I spoke primarily about Black women, this is a condition that really impacts women across the board, and it's estimated that women across the board, we're talking about close to 20 million women in the United States. Imagine that these women are suffering in silence, and they have not been fully educated on what this means for their lives and how they can overcome or mitigate the challenges that it faces. So, we have the opportunity with this legislation becoming law to have, simultaneously this education taking place in our communities while researchers are doing a deeper dive into its causes and what other treatments can be available to address this very debilitating condition.
I thank you for those words, Representative Clark. You've done a tremendous work and a lift in getting the policies to match what the people actually need. So we're very grateful for your work. And if there's anything we could do to support you, just let us know.
Well, thank you so much for having me, and thank you for focusing on this, because indeed our communities deserve this type of focus on our health. We are a significant part of civil society, and the impact of this on the workplace. This typically happens to women in their most productive years of life. And so, in the workplace and in every sort of sphere of her existence, there is this debilitating condition that needs to be addressed. And I think that as we educate and uplift this for the public, we will build the type of public sentiment that's required to make it law.
Still to come, one woman's personal journey. Years of suffering from fibroids birthed her mission to empower women across the nation. She tells us why she boldly wears white. Stay tuned.
Tired of nighttime period leaks? Even the best pads can leak at night from shifting, gapping, and bunching while you sleep. Try Always Ease disposable period underwear. They absorb 5 times more than ultra-thin overnight pads. Simply slip them on like a pair of underwear for comfortable 360-degree leakage protection that stays in place no matter how you sleep. Wake up to clean sheets. Try Always Ease disposable period underwear with a money-back guarantee. Brand Power, helping you buy better.
Tanika Gray Valborn. She's the founder of the White Dress Project and a woman who has suffered from fibroids for years. Thank you for joining us, Tanika.
Thank you so much for having me.
Yeah. So you're a patient and an advocate. Can you tell us about your experience with fibroids? When were you first diagnosed? How long did it take you to get diagnosed? And what has been your experience from that?
So my experience with fibroids started very, very early. I would say in my early teens. And I was really just thinking all along that, this was normal. My mother told me that, this is a part of becoming a woman. And I really didn't think too much of my symptoms, the heavy bleeding, the bloating, the pain. I didn't think anything of it. I thought this was just the path to motherhood or just the path to being a mom or just the path to being a woman, I keep trying to say. And I kept thinking that this is just how it goes. And it wasn't until, I got to college that I recognized that, no, this can't be normal because I started to experience symptoms of anemia. And I said to myself, this can't be normal. I went to the doctor, extremely anemic, had to get my first blood transfusion. Wow. And that's when I started to investigate, is everyone bleeding this way? Is everyone in this type of pain? And I recognized that, I really needed to do something about it. I went to other doctors. They told me that I needed a DNC because they could not figure out where the bleeding was coming from. And this kind of just sent me in a tailspin of what's going on? Are other people bleeding like this? My mother had fibroids, and I knew about her condition. I knew what she had shared with me. I knew about her multiple surgeries. But I also didn't understand that it could be happening to me. I just didn't make that connection. And so I began on this journey of what is happening? Why am I bleeding this way? Are other people bleeding this way? And I just continued to get the runaround from doctors everywhere. And as I'm in my career, finishing up college, I just decided that I was going to deal with it. And I think that's what so many women do. They know how to, protect themselves from an accident. They know how to medicate themselves before the pain gets really bad. And that's how I was living my life. I was always carrying extra pads with me, always had, my medication with me. And I really just lived my life like that and didn't really investigate what was the true cause of it. I ended up having the DNC, and it didn't solve any of the issues. And it wasn't until much later, I think I was about 25 or 26, that I went for my yearly annual exam. And someone said to me, hey, has anyone told you you have fibroids? And I remember saying, like, the thing my mom has, like just thinking that it couldn't be that. And that is when I got diagnosed with fibroids and really started to kind of understand the symptoms that I'd been experiencing.
That is incredible. So that was 10 years. When you mentioned you were so anemic that you had to have a transfusion, my first thought was, did they deep dive into figuring out why you were that anemic? Did they do any studies at that initial visit, whether an ultrasound of your abdomen to determine whether or not you had fibroids, or did that come years later?
That definitely came years later. And I think that is a part of my story that is so interesting, but not uncommon, right? There are so many women who hear, let's just watch and wait and see. Well, a lot of people are anemic because you aren't eating well. You're on the go all the time. And I really recognized that I was being dismissed. And I think so many women go through that dismissal process where, you go to the doctor, you tell your symptoms, you describe them as best you can, and you're still told, well, let's just see what it does. Well, you have all these things going on, so maybe that's the culprit. And really, we really need to be addressing that in the moment, I think, not to challenge our physicians and say, you don't know what you're talking about, but also to become an advocate in that moment for yourself and to say, well, no, I've been dealing with this. I know my body. I've been with my body my entire life. Mm-hmm. So knowing that your story and what you have experienced with yourself counts for something as well and should be validated.
It's one of those things for our viewers. It's titled Second Opinion. This show is titled Second Opinion.
Yeah.
It's very important to know that there should not be a menstrual cycle that drives you to have a blood transfusion. If you are to that point, you definitely need to go and seek medical attention. And if you don't get answers on that first visit, go get a second opinion. Now, question for you, what measures did you take to have the fibroids removed, if any?
Yeah, I just want to mention, just piggyback on what you just said. I love that so much. We often say in our community at the White Dress Project that, finding a good doctor and getting a doctor who is aligned with your mission is just like dating, right? If we are not on the same page, if we don't want the same things, if we don't want the same outcomes, then maybe we're not a right fit. So I love that you said that because, and the fact that the show is named that, because it reinforces the importance of finding a second opinion. Mm-hmm. In terms of my surgeries, I've had 3 surgeries, actually. I have had a myomectomy twice, which is the surgical removal of fibroids. My very first surgery, I had 27 fibroids removed, which was so impactful. And it started this whole journey to advocacy and really understanding what was happening in my body. And then I learned of the disparity that fibroids cause, especially with Black women being disproportionately impacted with them. So I had a myomectomy first, 27 fibroids removed. I've had multiple hysteroscopies, multiple polypectomies, all to really clear my uterus to ensure that I could carry a child. That has always been my goal. It's been my heart's desire ever since I've known myself. So I've had multiple surgeries for that and multiple blood transfusion that I told you about the one, when this journey began for me. But ultimately, I've had 8 blood transfusions due to the multiple anemic, times I've been anemic and doctors having to quickly get my blood stores back up.
When you couldn't see my face, but when you mentioned 7 fibroids, my mind just froze.
I know. Yeah.
With undergoing the removal of 27, for one, how was that not diagnosed 10 years? But with that being the case, how did it impact your ability to conceive? Infertility is one of those things in our community that is oftentimes not addressed. And in certain cases are linked to fibroids in itself. So how has that impacted your ability to conceive?
Oh, it impacted my ability to conceive greatly. I have gone through 10 years of infertility. My very first myomectomy was in 2013. That's when the 27 fibroids were taken out. I had to have a second myomectomy 5 years later. And I believe that was about 13 fibroids. So within that 5 year span, I had more that, grew. And then right after that, I had multiple hysteroscopies, just trying to clear my uterus of just polyps and matter and scar tissue, etc. In 2018, I believe I had a third myomectomy. And I was really concerned because at this point, my doctors had told me that my uterus had latched onto my bladder. So it was a very difficult decision to make to have surgery because you now have the bladder component. And what happens if something goes wrong in surgery and somehow my bladder is cut and then you have additional issues. But my desire to be a mother was so great. And I toiled with the decision, but knew that I wanted to ensure that I was a mother in some capacity. And I had gotten to the point that, adoption was an option for me. Surrogacy was an option for me. So I had a miscarriage in October of 2022. And my doctor said to me, let's just try one time. Let's just see what we can do to completely clear your uterus. At this time, I had 2 embryos left and decided to do the IVF process one last time after my miscarriage. And you can imagine after you've had such a traumatic miscarriage and traumatic experience happen to you, you're very skeptical about putting your body through this again, very skeptical if you will hold a pregnancy. And by this time, I'm of a certain age and, all the things that you think of. And I said to myself that, if this is my desire, then I believe in God. And I believe that, this was an important thing for me to do. And it was going to help my journey. And it was going to prove to me that I could get through something tough. And so in July of 2024, I found out that I was pregnant. And I found out on the 10-year anniversary of our organization's inception. And I was so thrilled, but so nervous. And I went through my pregnancy. Nothing went wrong. It was an amazing experience, Dr. Hilton. And I just feel like if I can leave anything with anyone, it's really to continue to have hope for whatever you desire. It may not be a child, whatever it is. If you have that desire, I believe that your desire will come to pass. So now I have my 11-month-old. He will be 1 on February 10th. I'm so excited for what he is to me and what he has brought to my life and my husband's life. And it really has given me a level of gratitude. People often talk about love when they have a child, and I definitely have the love part. But there's just a sense of gratitude that I have for the journey that I went through, the 10 years of running an organization, encouraging women to get their fibroid diagnosis, figure out what's going on, advocate for yourself. Going through that in the midst of the greatest desire to be a mother. And then on the 10-year anniversary, finding out that I am going to be a mother, going through a pregnancy that was uneventful, as the doctors say, and now holding my 11-month-old is the greatest joy of my life. And I'm so grateful that I get to experience that. But I will continue to advocate for myself and for women because I know that not everybody has this story. And it's not because you give up or give up on hope that your story doesn't pan out the way that mine does. So I want to continue to encourage women. I want to continue to make sure that our organization and the work that I do and the voice that I have is always going to be one that can support women who are on this journey.
Wow. I have a set of 7-month-old twins. So me being emotional, but hearing your story, because when you speak about that love that will make you cross any desert, I didn't know that love until my baby girls. And so, with your miracle baby, what do you see when you look at him? Like, what is the promise that he's kept for you?
Oh my goodness, that's such a beautiful question and a way to just frame the perspective and frame the experience. When I look at him, I literally see hope. I literally see faith. I literally see gratitude. And I don't know about you, Dr. Hilton, but I've never kind of experienced that before. I know you shared that about love, but I've never experienced like literally being able to look at someone and see those things in what seems like a very tangible way. I know that he will be an advocate. I know he will know about women's health. And I know I went through all of this, including starting an organization, being dismissed so many times, feeling like I had to argue with doctors, and knowing that I don't have a 4-year degree in medicine or haven't gone to residency, fellowship, all the things, and feeling like I had to muster up the advocate in me to ensure that I was getting the healthcare that I deserve, and partnering with doctors who wanted the same outcomes that I did. Every doctor that I had said to me, Tanika, we can do this. We can get through this. I will do everything I can to prepare your body. And even though I knew I had all those doctors, I had the best IVF specialist, I think, in Georgia. Even though I had all of those things, I knew that my faith still had to be where it needed to be in order for all of this to come together. I remember when I was going through my transfer for IVF, the doctor, finished the procedure, and she said, all right, Tanika, well, now all we can do is pray. All we can do is leave it to God. And I feel that, when people talk about IVF not being natural and, all the things that our society sometimes puts on women who decide to go this route, I thought to myself, like, yes, I've involved science and gotten some help, but at the end of the day, if it wasn't, if it wasn't supposed to be, it was not going to be without my faith and without what God desired for me. So when I look at him, I look at all of those things. I say to my girlfriends often, like, it doesn't even stress me out when he cries, and he's not a crying baby. He's such a happy baby. But when he cries or does anything, I'm like, he has breath, he has lungs, he has range. Maybe he'll sing, who knows? But I really get so thrilled at seeing my faith play out. I really look at him as like my reward for good service.
Yeah.
And some people may think that that's weird, but I know what I see when I look at him, and I know what I'll instill in him about women's health, about his health, and I know he'll be an advocate as well.
It's one of those things. It's an honor and a privilege to be able to be a parent, and and those moments when they need us, it literally feels like you said, like it's a greatest gift of I will do anything for you. And with your advocacy, with the White Dress Project, the work that you're doing are going to afford so many women the opportunity to experience what you now have because of the awareness you brought to fibroids. So what is the next step for White Dress Project? What does the next 10 years look like?
Yeah, I'm so excited about the White Dress Project because I know that we do good work. We look at our DMs, our emails, especially when we're getting down, because this work is hard. You had Congresswoman Clark on, and we work very, very closely with her to advocate for the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act bill that she talked about. We try to get women from all across the country to make sure they're engaging with their member of Congress to ensure that they understand that this is a public health crisis and it is a women's health issue that no longer needs to be ignored. The amount of funding that is allocated from NIH for women's health research, much less uterine fibroids, is minimal and dismal. So we work with her often to make sure that our members of Congress hear our story. We often bring doctors to Capitol Hill to ensure that they are hearing the stories of physicians who are dealing with patients with fibroids. But the next 10 years for the White Dress Project is really, really bright. Even in an era that we are right now where women's health is not a priority. It's not. Nobody seemingly cares about what's happening to women's bodies, and seemingly, are really trying to not even address the issue at all. But we understand that our stories are power, our stories are data, and we understand that continuing to move forward by telling our stories, continuing to show people and teach people how to advocate for themselves, because there is a particular way that you should advocate for yourself, not only in the doctor's office, but to your members of Congress, to your family members, to your tribe, in your workplace, that you have to advocate for yourself. So we will continue to do that work. We will also continue to be a support system. That is the greatest part of the White Dress Project that I love, which is the community that we've created. We have created a strong community of women who understand that they do not have to suffer in silence alone. In addition to that, it's not only about the women. It's about bringing in their husbands and their partners and their boyfriends to understand that when I don't want to have sex, it's not because of you. It's because I'm in pain. I'm bleeding for 21 days out of the month. I am having brain fog. I'm not emotionally there. It's also about making sure that our children understand what's happening below the belt with a woman, so that we can really eliminate this cultural stigma that we have when women talk about issues below the belt. And it's also getting the mindset of women to change. This is not something for us to be ashamed of. We didn't cause this upon ourselves. I remember when I used to go through all of this, I used to think like, goodness, what did I do to, have 27 fibroids in at one time and nobody seemingly know about them prior to. So we will continue to do all of those things. And just really quickly, the way we do those things is we have nationwide programming all across the country. We go to different states, hosting events, getting community together. And when we go to a particular city and women come out in their white dresses or white clothing, it's just such a grand feeling, because we know that we're in unity, we're in solidarity. We understand that we've never felt comfortable wearing white. We've never felt comfortable being in anything outside of Black, because you never, with fibroids, you never know when an accident will happen, because your periods can be so unpredictable. So we use the color white as a symbol of hope. And knowing that we usually don't feel comfortable, we are using this as a moment where we can rally together, knowing that this will not take over our lives. This will not be the end of our story. So a lot of times, women come and they DM us or email us or come to our event in Black and say, I just couldn't do it today. I don't know how y'all do it all the time, but I just couldn't do it today. And we say, it's okay, because we're wearing our white for you. And you will get to that point where you have that confidence and have that level of comfort that you can wear white as well. So for us, it's just a symbol. You never wear white to any of our events, that's fine. It's not about that. It's about using it as a symbol of hope, to encourage women that we will find a cure, we will advocate, we will partner with members of Congress to ensure that that this is eliminated and it's no longer a public health issue.
Wow. It sounds like that white dress is not only a symbol of hope, but a symbol of freedom and freedom.
Oh, I love that.
Yeah.
I love that. Thank you.
And up next, as she stated, patients don't want to be the medical doctor. So who can be that person that steps in to help diagnose you? Well, next up, we have Dr. Pierre Johnson. He's literally known as the fibroid slayer, and he has more news than just the fibroids. He actually wants to talk to you about your sexual health.
Introducing Always Maxi Size 6, our most absorbent maxi pad. It absorbs 75% more versus Always Maxi Size 2. And it features leak guards for clot control. Try Always Maxi Size 6, available at CVS.
So let's bring a medical doctor into the conversation. Joining me now is OBGYN Dr. Pierre Johnson. He's also known as the fibroid slayer. Welcome to the show, Dr. Johnson.
Thank you for having me. Pleasure to be here.
Yeah. Women, we want to hear from you. Not only do you treat fibroids, but you're also a sexual health expert. So let's start with how fibroids can impact a woman's sex life.
So, fibroids are important for two different reasons, size and location. Either they can be very big and they push on different organs, or location wise, they can be in very bad positions and places, So the uterus sits, right at the pelvic floor. So if you have fibroids that, are sitting lower on the uterus or protruding, causing an impact into the vagina, they can be, very painful. If you have very big fibroids that are pushing on other organs, they can also be painful during intercourse. So that's one way that the technical term of dyspareunia can be, or pain with sex can occur with fibroids.
Dr. Johnson, since I have you here, most women, most patients, when they get in front of the doctor, are, how do you say it, bashful to talk about sex. So since I have you here, I'm going to ask all the questions. All right.
Yeah,
so the question is, is sex ever supposed to actually hurt?
No, it's not. It should not hurt. It should not be a painful process. But one thing that I do see is that is that when there are problems, doctors really try to get quick answers and really don't do the diligence to find out what the true problem is. Two things could be true at the same time. You can have pain with intercourse and you can have fibroids and they not be related. You can have very bad bleeding and you can have fibroids and they not be related. So it's very important. So if a woman does present with painful intercourse, doing a very thorough exam and using some common sense to see if fibroids are actually the thing that is causing the pain with intercourse, because you have vaginismus, you have lichen sclerosis, you have so many different things that can cause pain with intercourse that really have nothing to do with fibroids, but it takes a really thorough workup and figuring out where the pain is. Is it with at the introitus, or the front part of the vagina? Is it with deep penetration? Is it with certain positions, right? Or is it with certain partners? Because it's size an issue, where a partner may be too large or too small, for that matter. So you really have to do a thorough workup and ask really pointed questions when you are looking at the origins or why someone is having painful intercourse.
And when you mentioned to do a thorough workup, is this, the title of this show is Second Opinion. If the lady has gone in and said, hey, it hurts when I have sex, and if there hasn't been a workup and she wants to go get a second opinion, what should be the workup? What does it consist of? Is it imaging? Is it labs? Like, what does she need to do?
Before you even go there, it's a conversation, right? So a good consultation should be based on discussion first, right? have you had, have you ever had pleasurable sex? Do you recall the first time you had painful sex? Did you have pleasurable sex with certain partners and then you have pain with other partners? Is there, any change in medications in your diet, anything that has happened traumatic in your life or experiences that we need to talk about? So it's really diving into like what the true problem is when it happened, because if you had pleasurable sex 10 years ago or even 5 years ago and now sex just started hurting, last year or 2 years ago, now we have to find out what happened. Same way with fibroids, right? It's like, I have women that are, in their early to mid 40s, and they come to me with bleeding and they'll say, well, it's bleeding and the doctors tell me this fibroids, take the fibroids out, that's all I want. Well, you've had fibroids for decades, right? You probably have fibroids in your late 20s, early 30s. And all that time, there hasn't been any bad bleeding until now you have bad bleeding. So could it be possible that your bleeding is not related to these fibroids? Absolutely. And ovulatory uterine bleeding, abnormal uterine bleeding is a real thing that happens and has nothing to do with fibroids. So just really, just that's just an example of how having a very pointed conversation and not only talking, but listening to the story and listening to patients and listening to, what the true problem is, and allowing them to talk, you'll really understand like where the problem is coming from.
It's one of those things. You're probably really approachable. I mean, you are the fibroid slayer. You have a shirt on. You're probably one of those doctors that many women don't get to meet when they walk into the exam room. So if you're going to give some advice to people who are listening now, how are you helping your individual patients maintain a healthier, more productive sex life if they do have issues with fibroids?
First and foremost, I'm just really figuring out what the problem is. Like I was saying, if you, if sex was pleasurable at one point in time, how do we get back there? Like what made it pleasurable then, and trying to figure out what's bad now, and realize that there are so many things that are involved when you talk about sex. It's not just a physical, it's a mental, it's an emotional thing, right? So if you're associating sex with a bad thing, there are women right now that don't have any fibroids, don't have any other issues, but they associate sex with an unpleasurable experience, right? So they immediately have a involuntary contracture of their pelvic floor muscles during sex, which can cause it to be painful. And so for them, pelvic floor therapy is where you have to go to really try to get to a place of relaxation to where they start to now have pleasurable intercourse. So it's just really a very pointed treatment plan or process for each and every particular person, as far as like what it is that's really causing the problem. And don't be afraid to talk about it. You have to have open dialogue and communication. There might be something that their partner's doing that they really, really don't like, and they had to really kind of endure and deal with because they think that that is really what is going to continue a fruitful relationship. Well, if that's the case, it's not fruitful if it's painful to you, so you have to have very open dialogue and communication, not only with your providers, but also with your spouse as well.
Yeah, and it's one of those things, sex shouldn't be taboo. Literally, we all are here because someone decided to have sex. So, but let's talk about one of the things that you're quoted as saying. You said that no fibroid is too big to manage, and that
Correct.
every woman should have the option to preserve her uterus. So, how do you manage that? If for our patient or our person that was talking earlier, Tanika, she said she had 27 fibroids, large fibroids. How do you manage that?
So I would probably argue she probably has more than that that's in
Mm.
there, So so first and foremost, the way I've been able to acquire the skill set is just not being fearful about, taking on any case. I've never turned down a fibroid case in my career, so I love the challenge, but the challenge is more so allow me to gain a deeper experience and skill set to be able to handle all cases. And if you think about it, the reason I say there is no fibroid that's too big to manage And if a woman so desires to, preserve her uterus for pregnancy, which is another conversation, that she should be able to do so. And if you think about it, a, you know, 11, 10, 11, 12, 13 pound kids come out of a uterus, and the uterus is preserved. So if you have a 10, 11, 12, 13 pound fibroid, why can't you preserve the uterus the exact same way? It's the same thing. And you should also, and the other thing that I say is that there's never a need for a vertical incision in benign gynecology. I don't care how big the fibroid is. I don't care how much adhesions or scar tissue or whatever. You never need to cut someone vertically up their belly for benign gynecology. So, when you have, cancers, that's a little bit different. But as far as benign, non-cancerous gynecology, you should always be able to do that through a horizontal incision low in the pelvis to preserve not only the uterus, but also, some people's cosmetic integrity, how they feel about their body as well too. So, but yeah, I'm able to attack all fibroids and however big or however many there are is because I built up a skill set from being able to see women with over 100, 200. My most fibroids I've ever removed is 304, which is a Guinness record, but I wasn't able to contact Guinness before so that they could put it in there. But to be able to do that and show that it can be done now allows me to do that for any woman that comes through the door. So it doesn't really matter how many fibroids you have. It's just having the experience level and the diligence to be able to give that gift to someone else to be able to do all of that and give them what they want. Because a lot of times doctors will not do that because it's painstaking. It just takes a lot of time to do. And to be honest with you, in the misogynistic country that we live in, women's surgeries are they are reimbursed at a rate that is laughable. It's absolutely crazy. So doctors just don't have the incentive to do it, so they don't do it.
And question for you too. You mentioned surgery. Is there a tipping point of where surgery is the only option?
Yeah, so I put women with fibroids in two categories, right? So there are women with fibroids, and for me, there are women with advanced fibroid disease. And for my definitions, no Google, you can't Google it. It's what I created is when a woman's dominant fibroid is at least 10 centimeters or greater, and or the combination of her fibroids takes her uterus to her belly button and beyond. Meaning the growth is that big that she could press on her belly button, she feels hard, and all the way up to her diaphragm. Sometimes that can happen. So when you have fibroid growth that's past the umbilicus or the belly button, that's advanced fibroid disease. And for those women, typically surgical intervention is inevitable. It's something that's probably going to have to be done. And as far as how it's done, that's the question. That's the biggest thing that you have to really come to with a patient, and it really is about what their goals are. Because if her goal is pregnancy, not just to have a baby, not just to be a mother, but if her goal is pregnancy, then we talk about how we get to that goal, because there's more than just her uterus that involves pregnancy. It's sperm, it's the uterus, it's the pathway, right? For sperm to get up to the fallopian tubes, fertilize the eggs, and then come back to the cavity. There's also her eggs, which are the most important part of the entire conversation, which nobody really talks about. Like, women are clueless, just take the fibroids out. But do you have the egg quality to do what you're trying to do? So that's that goal. But if the goal are symptoms are a different conversation, right? Because as long as you have a uterus in your body, you have a potential for problems. Just because you take fibroids out does not mean that your bleeding is going to automatically get better. Just because you take fibroids out does not mean that you won't have painful or cramps during your bleeding. There are other things that cause cramping and pain, endometriosis, adenomyosis. There are other things that cause abnormal uterine bleeding and ovulatory uterine bleeding that have nothing to do with fibroids. So when we're talking about symptoms, which is another goal to address, we have to be very clear about the options and how they will impact those and what's the risk versus benefit of those different options to achieve the goal.
Now, we in that talk, we know you're now the fibroid slayer, you're the sexual health expert. We also know that you offer vaginal reconstruction. And my question for those ladies that would like to hear, who qualifies for that? What category of women fall into the need of needing a vaginal reconstruction?
So vaginal reconstruction, to be honest, is more of a, personal thing, to be honest. It can be functional when, a woman may have, like, let's say for instance, redundant labial tissue, where things are kind of sagging and draping and they may tug during sexual intercourse or what have you. So it may be a functional need for correction. Well, a lot of times it's really just cosmetic. It's just they don't like the way that they look, or things cannot be as tight and firm as they once were, and a woman desires to have a correction of that too. So it's a mixture of things. It's really, is it functional or is it something that you really desire? So anybody can be a particular candidate for it. It's not to say that anyone is excluded. It's just really what fits into your life and your lifestyle and what you're looking for.
Well, you know what? Get ready, Dr. Johnson. I can already see your DMs filling up as we speak with new patients.
Yeah.
And thank you again for joining us and all the information you've given us from fibroids to vaginal rejuvenation. Thank you.
Absolutely. Thanks for having me.
Up next, I'm sharing my prescription of the week. Stay with us.
I'm Brittany Noble, Midwest-born, HBCU educated with experience in newsrooms across the country. Well, I've teamed up with Roland Martin to bring to you The Breakdown. This isn't just news. It's our stories, our voice, our community. Join me for The Breakdown, Monday through Friday at midday, only on the Black Star Network.
As you heard, far too many women are dealing with fibroids quietly and being told it's just bad periods. And when I say bad periods, I mean periods so heavy you're planning your day around a bathroom, bleeding through pads or tampons every hour, pelvic pressure that makes you feel constantly bloated, or pain during sex, and fatigue because you're losing so much blood you're becoming anemic. That's not just how your body is, that's an actual medical issue. And one of the biggest problems isn't just fibroids, it's the dismissal. Women are often told to tough it out, to normalize it, or jump straight into a hysterectomy without discussing options. But there are options. There are medications that can reduce bleeding. There are minimally invasive procedures that can shrink fibroids. There are surgeries that preserve fertility. The key is knowing you have choices and finding a provider who actually listens. We don't know exactly why fibroids are more common and more aggressive in Black women, but hormones, genetics, and possibly environmental exposures all play a role. And research is ongoing, but advocacy, well, that has to happen now. So if your period feels like it's running your life, if you're exhausted every month, if pain is interrupting your relationships or your work, don't minimize it. Track your symptoms, ask for an ultrasound, get a second opinion if you need one. Fibroids are common, but suffering through them is not something you have to accept. Your body isn't being dramatic. It's actually just communicating. And that, my friends, is my prescription of the week. Thank you all for watching, and we'll see you next week on Second Opinion.